onset infectious diseases have given us a great support and publicity in making the burden of fungal diseases in countries available to all. And we are very grateful to John McConnell for supporting GAFFI's efforts in this. So today we're launching our report on the Lima conference that David brought together many experts in the region, together with developers and manufacturers of tests and developers and manufacturers of pharmaceuticals. We believe that the way forward is supporting a country's own experts to make changes for their beneficiaries and our beneficiaries. However, in my career, I've learned that very little will happen or ever become sustained unless we have gained political approval at the top. If ministers of health can see GAFFI's efforts as part of their own portfolio, then things happen. That is why I'm delighted that we have the strong support of His Excellency Ambassador Juan Carlos Gamara of Peru, who is hosting with us this press conference today. If all of us at this press conference work together, then we can make a difference to the lives of those who suffer. So let us really try and make them beneficiaries to really benefit from what GAFFI can do. Thank you. And I turn over now to our next speaker, David.
Do you want to go next, Juan Carlos, and just say a few words of welcome?
Yes, of course. Thank you, David. Well, good afternoon here in London. Probably good morning to many of you. First of all, I wish to thank the Global Action Fund for Fungal Diseases for choosing the Embassy of Peru in London as an ally for the launch and this press conference on the report, The Revolution in Fungal Diagnostic Tests, Integration into Health Systems of Latin America and Caribbean. These days, I'm sure that there is almost a global consensus on the importance of having solid health systems able to face not only pandemics like the one we are sadly experiencing at present, but also other diseases that can also be fatal to human health. For example, we have seen with much concern that seriously ill COVID-19 patients get invasive fungal lung infections in numbers close to 30%. And we know that this, unfortunately, contributes to increase even more the possibilities of death of those patients. The GAFFI report also identifies serious health services gaps among the different Latin American countries, which is a call for action for significant increases in terms of resources and efforts in the treatment of fungal diseases, including the need of better diagnostics and access to essential medicines to minimize avoidable deaths. It's clear that there is much work to do in the near future, and I sincerely hope that this report contributes to raise awareness of the issues involved and leads to the best ways of tackling them. So thank you very much to GAFFI and all their team. Their work is much appreciated, as well as to all the health authorities, researchers, professionals, international organizations, and others helping to draw attention and to solve this very serious problem. Thank you very much.
John McConnell, do you want to say something? Or actually, it's me next time. We'll give a little talk. I'm sorry, got the sequence wrong. So I'm going to give you a short presentation about what we achieved really with our work in South America in our meeting, and this was a three-day meeting with a large number of participants from every country in South America, with the one exception of Bolivia, actually. we organized it with PAHO and the CDC, and it was held in Spanish, which was a challenge for me, but with simultaneous translation. It was held last September, and we would have issued our report in March, but for COVID. And but we have now issued that report, and it's on the GAFFI website under the resource section. And I'll just take you through various key elements and report aspects of the report. I do need to thank the multiple contributors to making the meeting happen, many of them from industry, but not all. The Universities of Manchester and Toronto contributed, as did PAHO and the CDC Foundation, as well as ISHAM. So GAFFI was founded in 2013, and we launched the foundation officially in the Parliament buildings in London, and within the same week also in Sao Paulo, in Delhi and New York. And we have since been focused on trying to collect and understand the burden of fungal disease and the impact on health across the world. So on any one day, we think there are about 13 million people at risk, immediate risk of dying of a fungal disease. So that includes the patients with very late stage HIV, profoundly neutropenic leukemia patients, patients in critical care, and so on. And of those, probably about 2 million develop an infection and die of it. And that ranks fungal diseases amongst the 5th most common cause of death worldwide, but it's obscured because of all the underlying diseases which contribute to death. Around 50% of HIV deaths are due to fungal disease. As you'll see, this has been now quite well validated in Guatemala, but it's also true in many other countries as well. And the average age of death is about 35 years, which is a real issue. We've had a very dramatic and welcome improvement in the speed and performance of many diagnostics in our area. But unfortunately, those diagnostic tests have only reached around 25% of the global population. And we need to try and improve access to those because they really are much better than the old style culture. We also have a problem with antifungal access. Although most of the older antifungals are on the essential medicines list, many parts of the world don't have access to these at all. On the positive side, most of the fatal fungal infections are due to 4 groups of fungi, and they cause about 95% of the deaths. So that's a smaller number of pathogens than, for example, in the bacterial arena or viral arena. So GAFFI's mission and vision are to reduce illness and death associated with fungal diseases worldwide, and particularly to focus in low and middle income countries. And as a result of the meeting in Lima, to also focus rather more on health systems, which is very important. I need to pay tribute to one of our senior advisors, Donald Cole, who has sort of put this on the map for GAFFI and for the whole area of medical mycology. The majority of the world's middle-income countries need improvement in health systems, and we think this is a particular focus. Many of the high-income countries have some needs, but they're less, and many of the low-income countries have more fundamental needs than some of the things that we can offer in fungal disease management. So we think our particular focus should be on the middle-income countries. Those of you who are medical will understand that in an area where diagnosis is not straightforward, that active diagnosis of fungal disease is very important to be able to initiate treatment appropriately. And it's the combination of access to diagnosis and treatment which is critical. And we've done a rough estimation, and it is rough, of how many lives could be saved if we did a better job. And we think that about 1.3 million lives could be saved from fungal disease if diagnosis and access to treatment was implicated every year. And from fungal eye disease, around 300,000. So that would improve lifespans, productivity, and economic stability. So we see this as a major improvement, and this fits alongside the Sustainable Development Goals of the WHO and the UN in multiple areas, including the primary area of Goal 3, but also several other areas in terms of providing economic and improvement and education. In 2016, a pivotal editorial was published in the New England Journal suggesting that it was time to have a model list of diagnostics. There had been a model list with the WHO for treatments for many years, but not diagnostics. And so actually we followed that, and we organized a meeting in April 2018 in Kampala with representatives from many, many countries to try and work out what the essential diagnostics should be for fungal diseases. And that led to a report which was published later that year. And in May 2018, the WHO issued its first ever list of essential diagnostics, and we were happy that there were 5 of tests on there which were relevant to fungal disease. A 6th was added last year, and we expect 3 more essential tests, Aspergillus antibody, antigen, and pneumocystis PCR to be added this year. A survey was conducted amongst about 130 laboratories in Latin America and the Caribbean, dominated, I should say, by Brazil, but nonetheless covering most of the countries. And these are a number of tests that were done. And you can see that even a test which is for lethal meningitis, cryptococcal meningitis, was only present in 75% of the laboratories. And other tests such as histoplasma antigen, which is an equally lethal disease in HIV patients, was only present in 20% of labs. So there's a real need for improvement in the laboratory capability. So one of the things that GAFFI has focused on, and Juan Luis Rodriguez Tudela, who is been working with me on GAFFI since the beginning and is now on the board and runs this program in Guatemala, focusing on improving diagnostics, has been identified an active case finding and screening approach to TB, cryptococcal meningitis, and other manifestations and disseminated histoplasmosis. And if you compare the background, there's a lot of interest, of course, in tuberculosis, some in cryptococcal meningitis, but very little in histoplasmosis. And there are guidelines which have just been issued now for histoplasmosis, but they've been around for a long time for by the WHO for TB. But the first ever guidelines from the WHO were issued for cryptococcal disease in 2016. So there's a real issue there. And in this program in Guatemala, what we've been able to show between 2017 and 2018 is a substantial reduction in TB mortality, which is very welcome, also in cryptococcal disease, but not yet in histoplasmosis. And that's probably a function of the lack of the correct drugs. But we've also increased the number of diagnoses made substantially in these centers. And although we've made a big impact in Guatemala in diagnosis, we haven't yet changed the number of drugs and the appropriate central medicines in that country. And we're hoping that the ministry will take this up. And there are many other countries in South America and Central America without these drugs as well. If you look at the new patients with HIV coming through, you can see that histoplasmosis was the leading opportunistic infection, slightly more than TB, and without these accurate diagnostics, many of these patients are diagnosed with TB and treated for TB. And we know that the treatment for histoplasmosis is very important. So if you have AIDS and you have histoplasmosis and you don't get treatment, then the outcome is always fatal. But if you do treat with amphotericin, or in less severe cases with itraconazole, you get very good outcomes. And so the value of diagnosis is really important. So this Guatemala program has engaged 85% of the HIV centers and patients across the country, and that the education for those healthcare workers was motivational and really helped not only in the direct quality of care for the fungal diseases, but also, as you've seen in TB and other aspects of care. The fungal infections were twice as common as we thought they were before we started the program. That histoplasmosis is particularly common, and new antigen tests, these rapid point of care tests, picked up about a third more cases than would otherwise have been picked up, and did so much more quickly. And so the fungal disease kills many more patients than TB in Guatemala, and we've managed overall to reduce the mortality by 7%. So diagnosis is key to success, but treatment access is also important. And I just want to point out to you that in Latin America, most countries still do not have flucytosine for fungal meningitis. This is a drug that was developed in the 1970s. It's off patent, and it's very effective. It improves survival from fungal meningitis by 15%. And one of the problems here is that it's not been prioritized by governments. It's not been prioritized by the Global Fund, and many countries regard their achievement of their 1990 targets, which have been agreed with UNAIDS, as more important than reducing death. But if you took flucytosine, and it costs about $10 a day, and it's given for around 10 days, then the global cost would be only $22 million or euros, and that would save about 27 million lives. And if you do the same calculation for Latin America, the total cost for the whole continent would be about 1.75 million, and that would save about 700 lives. So this is really, in the global health context, not a large expenditure, and it really does need to be adopted and taken forward by governments. Itraconazole is another very important drug for various forms of aspergillosis, but also histoplasmosis as well. And there's a lot of variable cost with this drug, and this, because most of the patients have to pay themselves and it isn't covered by insurance or the government, that's a problem. So you can see you've got really very expensive itraconazole in Ecuador, in Guatemala, and in Uruguay, and very inexpensive costs in other countries. So you've got this disparity of cost, which is really inappropriate and probably a function, one of the issues around market failure in this area. So our meeting outcomes can be summarized, and more can be read on in the commentary in the Lancet Infectious Diseases and on the website, that we need this implementation of the WHO central diagnostic list into each country. We need improved laboratory training using a common curriculum, and that needs to be linked as well to clinical training, but it's getting the laboratories up, offering all these tests, which is very important. There's a major problem with Candida auris and resistance in Candida across the world, and a major outbreak occurred in Venezuela, and so there's also a major need to increase the capability of determining resistance in fungi, and particularly in Candida, and that needs strengthening. There's a lot of clinical training required, particularly for specialists, and there are many different specialists involved in intensive care, HIV medicine, dermatology, ophthalmology, and so on, but also in primary care. All of these countries should have antifungals from the WHO Essential Medicines list on their list. And we also need the rapid introduction of the WHO guidelines on advanced HIV disease. And then, as we learned 10 days ago, the launch of the histoplasma guidelines for BIPAHO for the world, but particularly for Latin America. And in terms of imaging, which is also a critical part of managing fungal disease, use of digital imaging and then teleradiology by transporting images across the country to centers of excellence will enable smaller communities to have access to excellent care, which is currently quite difficult. So overall, our message is that we really do want to leave no one behind, and we really do need to improve access to life-saving diagnostics and antifungal medicines, and this really has to change. That I will unshare and I think ask John McConnell to make a few comments if he'd be so so willing.
Yes, thank you, David. You asked me to say a few words about health systems and infectious diseases. I mean, I just wanted to start by emphasizing one of the points that you were making about histoplasmosis. We had a paper published in the Lancet Infectious Diseases in 2018, which was a modeling study, and showed that in Latin America, there was estimated, depending on the modeling scenario, about 6,700 HIV-associated deaths from histoplasmosis, and that was comparable with the estimate of just over 5,000 HIV-associated deaths from TB. So a disease which is essentially neglected, it has a similar burden in vulnerable communities as a disease which is a focus of an entire WHO agency. So just moving on to health systems and infectious diseases in particular, the current COVID-19 pandemic has highlighted the need for health systems to be prepared to meet challenges both old and new, and called into question the resilience of health systems even in the best resourced of countries. There was a report in the Lancet in 2015 written during the West African Ebola outbreak and prompted by that outbreak, which attempted to define what health system resilience meant. And among the definitions was the capacity of health actors, institutions and populations to prepare for and effectively respond to crises, to maintain core functions when crises hit, and to be informed by lessons learned during the crisis and reorganize if conditions require them. The report also said that health systems are resilient if they protect human life and produce good health outcomes for all during a crisis and in its aftermath. That health systems can deliver everyday benefits and positive health outcomes if they are truly resilient. And it also emphasized a commitment to quality improvement. And I think it's the latter 2 points which are particularly relevant and bring into focus some of the priorities noted in the GAFFI report. And I particularly note the need to strengthen the diagnostic capability for fungal diseases, for routine availability of essential medicines within well-prepared health systems, for better public health response to fungal diseases, particularly disease surveillance programs and resistance surveillance programs, and for the adoption of international guidelines for laboratory and clinical practice. And finally, COVID-19 and the new reality of what we're doing now, which is communicating remotely, has highlighted the real potential for the final priority noted in the GAFFI report, and that is for health systems to deliver care via telemedicine and artificial intelligence systems where there's a shortage of healthcare professionals.
Very good. Thank you very much. So we might there might be an opportunity for some questions from those there, or comments. Though I can see some of you were at the meeting and may have want to amplify some points or make some additional points. If you've got suggestions or thoughts.
Sería bueno de escuchar algo de nuestros colegas de América Latina, si se podría añadir algo.
That's great. So maybe I could call on Linky, who's at PAHO, to make a comment from your perspective. You could represent PAHO, I think, in this dialogue.
Sure. Thank you, David, and thank you for an excellent presentation and overview, and really indicating and showing the seriousness of this this disease. Yes, I was at the meeting, and it's very good to now see the products coming out, that we have really the advocacy with the report on the GAFFI website, and as well, of course, now with the letter in the comment in the Lancet. Yeah, I think what you presented is very important, especially also your focus on the diagnosis being key to success. And yeah, we've been, of course, my participation in the meeting specifically in Lima was I was there representing the AMR team, the antimicrobial resistance team. And so our focus, so I work for PAHO, of course, but working specifically for the AMR special program. And so the focus that is also being given, and the attention that is being given to the issue of antimicrobial resistance, that is actually adding now on top of this already very serious disease outcomes, is of course very prominent and present at the moment. I just wanted to highlight that this therefore also really well connects to the global initiative of the surveillance, the AMR, the importance and strengthening of AMR surveillance, as you were saying, which is directly linked, of course, to the laboratory capacity building needs in that sense, and being able to really properly detect resistance in fungi, and to be for laboratories to be able to have good susceptibility testing materials, but guidelines as well, because this is still extremely challenging. And maybe one of our partners from CDC, I think there's some on the call as well, would like to add to that as well. Because that capacity building is greatly needed worldwide, and of course also in the region of PAHO. So thank
Great.
you for giving me the opportunity to talk and just to give a comment.
Thank you very much.
Thanks.
So maybe Diego, who's from Colombia but working at CDC, could make a comment. He's been heavily involved in histoplasma diagnostics and the guidelines.
Sure. Thank you, David, and everybody to organize this meeting. Dr. Tom Schiller apologized because at this moment he is in another webinar with the ECHO platform. So they have been doing some weekly seminars related with COVID and HIV, and that seminar is happening at this moment. So he say that he's apologized to miss this call. Very happy to see all the results of this meeting, and as Ninke mentioned, we have been working in the region in some activities related with laboratory capacity. Started back in 2008 in Guatemala with the first development of an in-house histoplasma antigen test, but it's like a long way and a lot of improvements. So currently we are trying to focus our efforts in the technology transfer of commercial kits. Fortunately, since 2015 is available commercial ELISA for antigen detection, but within that proximally is going to be available a lateral flow device for histoplasma antigen detection. So probably that is going to change a lot the implementation of these activities. So thank you to David and also Juan Luis and Ana to involve us in the current activities in Guatemala. It's a wonderful job, all these fungi red program, because at this moment we are looking at this implementation of this fungi red program is saving lives and is changing a lot the current situation of HIV and the infections in this country. And most of the countries in the Latin America region, everybody's like we want to have something similar like a fungi red in Guatemala. So people is trying to reply that program or that strategy on their countries. So I just want to say thank you and congratulations for all this effort in the Latin American region.
Thank you very much. I don't know whether Susanna, who's from Ecuador, would like to say anything. She was at the meeting as well. She's one of the GAFFI ambassadors. I don't know, Susanna, if you want to say something. Maybe not. So maybe if not, then I could ask Dora from Mexico. Dora's been heavily involved in fungal diseases for some time now and also attended the meeting. Do you want to make any comments and amplify any of the points?
Yeah, sure. Thank you. First of all, I would like to thank GAFFI and you all involved in this. I'm very happy to see Latin American priorities on the map. So thank you very much. I just want to highlight the importance and follow up all these suggestions and observations, and also how important I think it is to remember we need to bring on board the real decision makers in order to make all these suggestions and plans successful. And then also I would like to let you know, and also for the ones that maybe don't know, but that now the antimicrobial resistance program of the WHO is considering resistant fungi in their surveillance programs, which is also very important, and I would like to see Latin American countries participating in that as well. I think it will complement very well the GAFFI's initiatives. So yeah, that's I think all what I can add.
That's great. Thank you very much indeed. Let me just see if Susanna, do you want to say anything, or does anybody else want to ask a question or make another comment?
I would like to make a comment. My name is Marcelo Galas. I am working in the group of NINCE here in Pajo, Washington, D.C. And last year we developed a training course for all the region, the complete region, the complete Latin America, about mycology in general, and was a very good, successful. More than 60 participants we had in the training. And this year we are moving to do a new training. We are working on that at this moment, especially about laboratory and all the methodologies that you can apply and are available in the region to identify and do susceptibility tests for Candida. It's related with the protocol that we are implementing about surveillance of Candidemia in Latin America. We have 12 countries on board at this moment, but the training that we will conduct from probably August of September this year will be focused in the complete region, and is with the help of Diego and the group of CDC. We are working together in this task in the Americas. And also to comment that we already have the protocol that we developed with the headquarters about surveillance of Candidemia, and we have a standardized configuration of HUNET program to collect data about bacteriemia, about bloodstream infection in general that include bacteriemia and Candidemia. And we are ready to start, and we already have some data from Colombia. We will receive shortly 10 years of surveillance of Candidemia from Uruguay, and probably at the end of this year we will have more data about the situation of Candida bacteriemia in the Americas. Yeah, just to comment this improvement that we have in the region. Thank you very much.
Thank you very much. So that's the Latin American net. Yeah.
Hola.
Hola.
Can I speak?
Please,
I am
yes.
Susana from Argentina. Oh, I'm so sorry. My English is really bad. This is the reason because I didn't want to talk. But I am very happy to be in this presentation. And now Marcelo has talked with you and explained it.
Thank you.
Our situation,
Fantastic.
Sorry, because my English is
That's
really
fine. No problem. Thank you very much. Another person who was at the forum is Agustina Foresterio. I don't know if you want to say anything, Agustina. You contributed to the AMR component of the meeting quite substantially when you were in Lima. No, I think she's silent. Oh, maybe she's, oh, yes. Hello, Agustina. Hello. You want to say something? Are there any?
Agustina's, I can speak maybe on her behalf.
Yes, okay.
But, no, and I think it's what Marcelo said in terms of the progress we're making in Latin America. I think it's a great summary. The only thing we might be able to add, Marcelo, is the fact that we're also including countries to participate in EQA for mycotic, for susceptibility testing in fungi. So that is, of course, also very important in terms of capacity building and improving laboratory capacity in the region.
Yeah.
So yeah, that's the final thing I think we can add. And
okay.
I have another thing that
even more.
No, because we are very happy because from the beginning of this year, we have the first collaborating center, collaborating center in AMR for mycotic infection disease, that is Argentina. Yeah, it's the group of Malvern Institute. It's a new collaborating center in the region that is helping the rest of the countries with the implementation of antifungal diagnosis.
Great. That's very good. I see Guillermo has joined us from Argentina. Guillermo, do you want to make any comments about the meeting? I realize you've come in a little bit late, probably to participate in the Spanish-speaking section. Guillermo is helping. One of the decisions we made at the meeting in Lima was to apply for the echinocandin antifungal drugs to be approved as essential medicines at the WHO, because Candida auris is resistant always to fluconazole and sometimes resistant to amphotericin. So we need echinocandins as a first-line therapy, and Guillermo is the point man who's been writing that draft for us, which I think has been very helpful. Do you want to make any other comments, Guillermo?
I just arrived, sorry. But I have a problem with the pandemic issue. They stopped me in the way to my lab. So I arrived a little late. But I'm writing as David said, the draft for the echinocandin approval as a drug for the World Health Organization. Juan Luis Rodríguez Tudela also is helping me a lot. We are now including the pediatric section that it was missing. So I will finish that next week, I think. So we are going forward with that writing.
Yeah, it's very, very much appreciated because it's a very important task, I think. Are there any other final comments as we close the English section and then I pass over to my colleague Juan Luis? Are there any other thoughts or comments? For me, as a sort of final comment, that Latin America is a very remarkable part of the world in fungal terms because there are so many endemic fungi there. It's probably the richest part of the world in terms of fungi that live in the soil, which you can catch, histoplasmosis and paracoccidomycosis, sporotrichosis in particular. But there's also an outbreak of sporotrichosis related to cats which has left Brazil and is now entering many other countries. So there's millions of feral cats, and these transmission from cat to person is causing many thousands of cases across the region, and that is a particular problem, I think, in Latin America. We also found in the meeting that there were some countries which were very poorly equipped to handle fungal diseases, with almost no drugs or diagnosis apart from culture, microscopy, and fluconazole. And so there's a really major need to improve the capabilities in many of these countries. Others are better equipped, but it's still a challenge, I think. So with that, I think, unless there are any other final questions, I think we'll close this part of the session, and then we'll move into the Spanish-speaking meeting, which I'm afraid my Spanish is not competent enough to be able to lead. I suspect there'll be one or two other English-speaking people who will leave because their Spanish isn't up to it either. But anyway, thank you all very much for joining, and it's really very much appreciated. And I think we'll pass over to Juan Luis, who can make a general introduction into how he found the meeting and give you a similar talk, but in Spanish. Thank you very much.